Welcome to a series of presentations selected for topics in biomedical informatics. This video is produced by the University of New Mexico's Health Sciences Library and Informatics Center and is licensed under a Creative Commons Attribution Non-Commercial Share-alike 4.0 international license. This means you're welcome to share and use this video for any non-commercial purpose as long as you give credit to the original authors. We hope this and future videos will be informative to those interested in learning more about informatics in healthcare. This is Robby Atala, and here I'm giving a small presentation on careers in health informatics. I'm a first-year clinical informatics fellow at the University of New Mexico. What is informatics? Informatics in healthcare is not as well defined as other more conventional disciplines like pharmacy, nursing, or medicine. It is actually a complementary spectrum of skill sets that could be applied in many of those fields like pharmacy, medicine, genomics, public health, and biology, to name a few. Actually, it is easier to state what is not informatics. It is not information technology. Health informaticians usually do not troubleshoot network or database problems. For further information on what biomedical informatics is, please refer to the previous presentation by Dr. Phil Croth. Clinical activities and research are producing large amount of data that needs to be cleaned, aggregated, analyzed, and acted upon. In general, people who undertake the analysis and modeling of the data work as researchers in research facilities, and people who make decisions based off of the data analysis work in operational and leadership capacity. To simplify common career choices for informatics, I will talk about two major paths. One is research path and data analysis, and one is an operational and more geared towards leadership. First, I'll talk about the research path. Informaticians who work within that path usually hold a PhD and/or a master's degree in biological sciences, biostatistics, computer science, and so on. Their informatics skills revolve around big data analysis using various programming languages like R and Python. They build predictive models and simulations using existing data to predict or simulate new observations and new situations. Those are the fields of genome informatics, pharmacoinformatics, chemoinformatics, and so on. They work at academic medical centers, pharmaceutical companies, and research labs. Government agencies like the Center for Disease Control and National Institute of Health are also common career choices for informaticians. I would like to mention that a fellowship in biomedical informatics is currently a common career path for candidates who hold degrees such as PharmD, Doctor of Physical Therapy, PhD, and even for candidates who hold degrees in non-healthcare related fields like anthropology. Candidates apply to academic institutions like the University of New Mexico, and if accepted, they get a yearly stipend and spend around 3 years conducting and writing research on various topics, ranging from the sociocultural aspects of informatics and its impact on healthcare to analyzing healthcare data and reporting their findings. During their fellowship training, some attend formal classes within their training curriculum where they end up getting a master's degree in clinical research. Now I'll move on to the operational path. This field does not usually require proficiency in programming or deep data analysis. It, however, merges leadership skills and the ability to incorporate data findings prepared by analysts into decision making. in designing strategies to better the performance of the company or institution they work for. People in this domain are familiar and well-versed in project management approaches, such as the Lean method adopted by Toyota, which is focused on eliminating waste during the production process. A simple example or application in healthcare would be to design a process where the RN stores all the supplies she needs for patient care in her wheeling cart instead of moving back and forth between the patient's room and the supplies room. Close to the lean approach, another approach to project management is the Six Sigma, where the purpose is to minimize the number of defects in end products. A simple example in healthcare would be to implement a protocol where all patients with pneumonia receive antibiotics within the first 24 hours with an end goal to save more lives. People who are in this leadership domain are usually pharmacists, registered nurses, and physicians. Some of the positions and titles they have are a CNIO or a Chief Nursing Informatics Officer. This is someone who was a registered nurse before and who developed knowledge in health informatics and leadership skills over the years. By serving as a liaison between clinical care and information technology, a CNIO leads in optimizing electronic health records and align it with an efficient nursing workflow. A CNIO may be tasked with the preparation of compliance documentation to meet state and federal regulations for patient safety and privacy. Another position is a CMIO or a Chief Medical Informatics Officer or a Chief Health Informatics Officer. This is someone who was or still is a practicing physician and who has leadership traits like a CNIO. By serving as a liaison between IT and physicians, he or she helps optimize electronic health records and make them more user-friendly. By working closely with different clinical departments, they establish order sets and design clinical workflows and protocols to make clinicians' work and the process of delivering care more efficient. A CNIO and a CMIO sit on the Health Information Committee of a hospital where they formalize protocols and troubleshoot impaired processes in clinical care, especially when related to electronic health records. A simple example would be to draft a protocol to allow patient access to their own records while maintaining their privacy. Another example would be to coordinate with another facility to formalize a process for exchanging patient clinical information in a safe and secure mode compliant with HIPAA. This concludes the presentation on careers in health informatics. For more information on this and related topics, please visit our website or contact the Biomedical Informatics Research, Training, and Scholarship Program.